Module Overview. Airway management and rescue breathing are the cornerstones of basic life support. BLS, especially when cardiac arrest results from hypoxia, which is often the case in pediatric and trauma scenarios. The ability to establish and maintain a patent airway and provide effective ventilation is critical to survival. This module delves deep into the anatomy, physiology, techniques, equipment use, and clinical decision-making associated with rescue breathing and airway management in both pre-hospital and clinical environments. It also addresses high-risk situations, barriers to effective ventilation, and the importance of post-resuscitation airway care. Anatomy and physiology of the airway. To manage the airway effectively, understanding its structure is vital. Upper airway, nasal cavity, pharynx, epiglottis, lower airway, larynx, trachea, bronchi, lungs. Critical points. Obstructions can occur at any level. Tongue is the most common cause of obstruction in unconscious individuals. Gag reflex must be understood when performing oral maneuvers. Recognizing airway compromise. Signs of airway obstruction: inability to speak or cry, stridor or high-pitched wheezing, cyanosis, bluish lips or face. Use of accessory muscles, paradoxical chest movement, conscious versus unconscious, in a conscious person. Encourage coughing, in an unconscious person. Start chest compressions and rescue breaths. Manual airway maneuvers. 1. Head tilt, chin lift technique. Used in unresponsive non-trauma patients, tilts head backward while lifting chin to open airway. 2. Jaw thrust maneuver. Used when spinal injury is suspected, requires more skill but avoids neck movement. 3. Tongue jaw lift, advanced. Used in cases of severe airway obstruction or during suctioning. Rescue breathing techniques. Rescue breathing provides oxygen to a person who is not breathing adequately but still has a pulse. Age group, breath rate, breath duration. Adult 1 breath every 5 to 6 seconds, approximately 1 second. Child, infant, 1 breath every 3 to 5 seconds, approximately 1 second. Key aspects: make the chest visibly rise, but avoid overinflation. Use pocket mask or barrier device for infection control. Ensure airway is open throughout. Use of airway adjuncts. 1. Oropharyngeal airway, OPA. Keeps tongue from blocking airway, used only on unconscious patients without gag reflex. 2. Nasopharyngeal airway, NPA. Inserted through the nose, can be used in semi-conscious patients or when OPA is contraindicated. 3. Bag valve mask, BVM ventilation. Delivers high-flow oxygen, requires skill and proper technique to create a tight seal, best with 2 rescuers. 1 seals mask, 1 squeezes bag. Barriers to effective rescue breathing. Poor seal of mask leading to ineffective ventilation. Obstructed airway not cleared properly. Vomiting. Aspiration during ventilation. Inadequate head positioning. Hyperventilation leading to decreased cardiac output. Oxygen delivery systems. Overview. Room air. 21% oxygen, supplemental oxygen. 100% when using BVM or oxygen tank devices. Nasal cannula. Non-rebreather mask, simple face mask. While not always available in community CPR, awareness is critical for clinical readiness and professional practice. Airway management in special scenarios. 1. Trauma victims. Suspect spinal injury, use jaw thrust only. Avoid excessive neck movement. 2. Drowning victims. Immediate ventilation is essential. Begin rescue breathing even in water if trained. 3. COVID post-COVID. Use of PPE is critical. Prefer barrier devices and limit aerosol-generating procedures. Learning outcomes. By completing this module, you will be able to understand the structure and function of the human airway, identify and manage airway obstructions effectively, Perform rescue breathing across all age groups using appropriate techniques. Utilize airway adjuncts and BVM systems when applicable. Integrate ethical and clinical guidelines into emergency airway management. Accreditation alignment. This module adheres to the following international and regional standards: AHA, American Heart Association, Basic Life Support Guidelines, European Resuscitation Council Recommendations on Airway Management, UK Resuscitation Council, Advanced BLS Framework, ILO/WHO Health Worker Competency Guidelines, ISO 29993:2017, and ISO 21001:2018 for educational quality and learner support. Ethical, cultural, and legal considerations. Always consider implied consent in unconscious patients. Be sensitive to cultural norms when performing mouth-to-mouth document airway interventions in professional settings. Follow Good Samaritan laws for public response.